So if you think the Senate's going to overturn health care reform, you are crazy. They can't get the votes to do it. They can't do it, and nothing will happen from the Democratic perspective because the Republicans can block cloture forever. So the Senate will be gridlocked. The legislative process will be gridlocked. What does that mean? It means, as I said, we're unlikely to overturn. Why are we unlikely to overturn? Democrats knew what they were doing when they passed this bill. If you recall in our presentation back in March or April, whenever it was, we talked about how the Democrats really slammed this through. They slammed this through in the only way they knew was possible, which was get it in because Scott Brown won the election in Massachusetts. And we no longer could have cloture. So they had to get it in, get it done, get it passed for what the Senate had already passed, which was the finance bill. And then the House passed this reconciliation bill. And the Senate only needed 51 votes to pass the reconciliation bill. That's how it got through. To overturn it, they knew they needed 60. So they made this difficult. Excuse me, what else did they do? They put in law provisions that are effective today. It is very, very difficult to take legislation that we all are working with today, that we all put into our health plans that are starting this year, and then say, oh, wait a minute, dependents age 26, for example, are no longer allowed to be in the plan. It's now back to 24 or 25. You got a whole bunch of angry dependents who are 25 years old living on my dad's couch saying, why am I not allowed to be in a health plan? So that's not available. That's what they did at first. President Obama is likely to veto it. So not only do we need to end cloture, I need to go back and get a 2/3 majority. You don't have anywhere near those numbers. President Obama will veto any health care reform bill that comes through that messes with the system unless it's part of a package. The majority in the House exists, but you need 60 votes for cloture, so that's not going to happen. The main reason it's not going to happen, though, we can talk about all this politics all we want, is some of the provisions are popular. If I'm going to come out and say, I want to overturn health care reform, the first ad, if I'm a Democrat that I'm running, says Republicans like pre-existing conditions. They like it when insurers can say, I'm sorry you had a knee injury and I don't have to cover you. They like it when insurers can say you have terminal brain cancer and I'm sorry I don't have to cover your brain cancer. I'll cover everything else, but not your brain cancer. That's wildly unpopular. I have to say that I like lifetime limits. I'm going to drag out every poor, really tragic child I've ever seen in my life who's got leukemia or terminal leukemia that's got $10 million in medical bills, and I'm going to say little Johnny here does not get coverage because you don't like health care reform. You like lifetime limits. You like cutting this family off and making them destitute. Not going to happen. Dependent coverage. I like dependents losing health care coverage when they're 25. I like people without health insurance going bankrupt because they can't pay. These are the ads I'm running. I like cost sharing. I like more money out of your pocket. Hopefully you're getting a flavor of why it's not going to happen. Those ads would be devastating to any Republican trying to be in office. And what does this is the part of the presentation, who knows what do Republicans want more than anything else out of the next 2 years? Anybody? It's one office. Presidency. We just had a midterm election where there was a shellacking in President Obama's words of Democrats. What do Republicans want more than anything else? They want the White House. And why on earth would you take away an incredibly lightning rod provision and take it off the table for the 2012 election? When I sat here 6 months ago, I thought it was impossible President Obama would get it. I still think it's nearly impossible. I think it's going to be kind of like Harry Reid's election in Nevada, where we can talk about it. First of all, the Republicans have to run a candidate that has any sort of ability to win a national election. And I can tell you very clearly the ones that are out there are not. Republicans can't get out of their own ways. Political, I don't care what party you are, but right now the Republican Party has a real fractured group of individuals of where you are. You have your Sarah Palin party, you still have your John McCain party, and you've got your religious Mike Huckabee kind of party out there. That's really impossible probably to put somebody in an election. What I do think is very dangerous, and the only way President Obama gets beat, came out of Wisconsin, which was Russ Feingold. He's a very, very liberal senator who got beat in Wisconsin. If he runs for president, he will force Obama to go way left, because there's a big piece of the Democratic Party that says if you're not going to be liberal about enough, why do we want you? If that happens, you've got an opportunity for a centrist Republican to come in, just like Obama seized kind of the anti-war change provision a few years ago. I don't think they can do it in 2 years, though. But that's the only way Obama loses the election. And it's the only way the Republicans hit the White House. But they will do everything they can to keep it. And the tax cuts are a great example of this. When you read about the tax cuts and you see Republicans saying tax cuts for everybody, it's got to happen, And Obama's saying, well, we need to extend some tax cuts, just not the richest 0.5%, 1%, whatever. You see Obama trying to take things off the table. Republicans have to come out and say, I'm willing to hold up your tax cuts, all of us probably, our tax cuts, in order for this richest 0.5% of Americans to gain more money. That's what the political arena is about right now. So as we talk about healthcare reform, there's nothing I want to do more than keep healthcare reform on the table and in the public's mind until 2012. And if I can get the White House, I can do all of the things I want. That's the Republican game plan. That's why you're likely to see what we have today in healthcare reform continue on for the next couple of years. What happens in 2012 is going to be very important. Where the House will impact healthcare reform is in appropriations. Appropriations is a big word that we all hear, and probably none of us know what it means, but it's the financing arm of the Congress. The Republicans now will be the committee chairperson in all of the House committees. The majority party gets to be the chair. So remember Gordon Smith, when he was senator here in Oregon, for example, and the Republicans were in power in the Senate, was chair of the Senate Health Committee on Aging. It was also that, but it was the Health Committee. And Gordon Smith ran that. He doesn't anymore because he's not in office, but also the Republicans aren't there. You have a lot of committee chair people now that are going to be in charge of appropriations. That's where I give financing. Now, you heard a lot about, if you listen to the news at all back in November, about this idea of shutdown. Does anyone remember back in 94, 95 when Newt Gingrich shut down the government? It was a remarkably huge issue at the time, and I'm amazed at how few people remember that now. But it essentially killed the Republican Bob Dole's chances of winning the presidential election. The Republicans shut down the government and said, no more spending. No more spending. We won't vote for spending. We're cutting spending, cutting spending, cutting spending. The Democrats said, we've got a debt ceiling, which this country continues to have. If we don't authorize more debt, we can't run the government. The Republicans said, no, 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 no. If you ever watch a West Wing episode, there was an episode directly on this point, and they shut it down. It was hugely unpopular, hugely. That derailed Newt Gingrich entirely. The Republicans, I don't think, will do that again. Many people forget that Newt Gingrich's #1 lieutenant was John Boehner, who is now going to be the Speaker of the House. John Boehner lived through the shutdown, he lived through the unpopularness of it, he won't do it again. So you won't see that, but they will hold up spending on certain pet projects. And how do you do that? The agencies that work, the IRS, the DOL, they need funding. And if I'm a Republican House member, what I'm going to do is pass a bill that prevents funding for things related to health care reform. It prevents CHIP, the Children's Health Insurance Program. It prevents insurer subsidies. It prevents dollars being spent on enforcement for health care reform violations, for example. That's what's going to happen. There are 115 pieces, as I counted last, in health care reform that require spending authorization. The Republicans will hold up many to all of them. And they'll pick at things that aren't in the public eye, just like I just asked you the question, remember the shutdown. You'll remember the major news on CNN, especially in today's world, but you won't remember the little things that don't get funded. And they'll hold those up in exchange for something. Now that's how healthcare reform is going to be impacted. What does that mean to you as businesses? It means there's a lot of uncertainty about what you're going to need to require and what you're going to need to do and pay attention to. Nothing is known for the next 2 years. But it's more than likely, the good news is, there will be absolutely no enforcement of healthcare reform violations. There's this excise tax everybody talks about. So there's a good story for it. A friend of mine, or a guy who owns a golf course in Eugene, comes up and he says, I've got this plan due December 1st, and Pacific Source tells me that they are not grandfathering any plans that are CHI. I cover myself and a key manager, I don't cover my other like 9 workers, because they all work in the golf course and they make whatever, $9 an hour, and I don't provide health insurance for them. What do I do? I'm not grandfathered. Pacific Source, the carrier, is saying, we're putting out something that says you're not grandfathered. I don't care. If you fail grandfathering, you owe $100 in excise tax a day that you fail to discriminate. These are the kind of real-world issues facing the business owner today. I have to now look up on the web or call a lawyer and spend $3,000 figuring it out. I have very little consulting or expertise. Why? Because I don't work with a company like Xenium, or I don't have people I can call. And now I'm supposed to figure out with this threat of $100 a day and hearing from Pacific Source about a week before my plan is due, how do I do this? What do I do? That's the problem with healthcare reform right now. The average small business, average consumer, and as you sit in this room, you can agree or disagree, but I don't know how you are able to figure out what healthcare reform is about. You come to these presentations, it's great to have people like Xenium to count on, but it is very, very complex, and any person like me who we've established has a horrible personality that does know something about healthcare will tell you that it is very complex and difficult to know. It's going to be hard to follow. You rely on your insurance and brokers, and I urge you to continue to read, continue to attend, and get good people who can help you on economies of scale, because it is difficult. I don't want you to face what my Fred faced, which was, I am scared that I'm going to get a bill from the government for $100,000 2 months from now when I put in my health plan into place, and I just want to cover my family and key employees. Good news, as I told you, is I don't think there's any chance you'll get that $100,000 penalty. I don't think there's a chance the government will even call you. But I do think it matters. I do think you have to be careful of the insurers out there who are just doing their job saying, here's what we're doing. Now, do any of you remember HIPAA when it passed, the privacy laws? That was that's forever ago now. I can remember 2004 for most small businesses when you had to comply. The hospitals and insurers back in HIPAA, and I think it's a great way to look at healthcare reform today. Their initial reaction, remember the lines at the supermarkets, the big, you cannot cross this line at the Safeway because our pharmacy is here because of HIPAA. I want to call somebody about a hospital. My friend had a baby due today. I'm sorry, we can't tell you anything about that person because of HIPAA. Back then, the initial reaction to HIPAA was, we're doing nothing unless you tell me it's illegal. That's how you're going to see healthcare reform in the next year on this side. We're going to do nothing. We're going to comply with the law. We're going to tell you nothing, give you no guidance until you can tell us what you're doing is allowable, which is incumbent on you to learn the rules and understand it. We'll go back to what we talked about at the beginning. Healthcare reform is about you individuals getting access. So as we move on to the executive agencies and the actual meat of this presentation, understand that anything in healthcare reform is about how do you get coverage if you couldn't get coverage before. How many of you today have coverage under individual policies? A couple of you. How many of you today have coverage under your employer? That's the majority of the delivery system today is the employer. Nothing changed. Nothing will change until 2014. It's all about how you write things in documents and who's eligible, and we're going to talk about now. Does anybody have questions about legislation? Susie does.
Well, I do about the guy who owns the golf course.
Yes.
So basically, it's just kind of a, taking a risk.
It's actually not, and it's a good question. And so what happened in this case was it ended up that since nobody at his golf course ends up making any kind of money, nobody's actually a key employee, and he can willfully still discriminate, so to speak, against his other people without failing discrimination tests.
Because none of the
there's no other key employee.
The key employees meet that actual.
Meet actually the definition.
They don't make that threshold of income.
So it's a great question on what exactly happened. The response from Pacific Source was, you can't discriminate.
Right.
And it's not my job to tell you anything else, and they're right.
Sure.
So how does he get that answer? And you might have this penalty. What does he hear as a business owner? Penalty. What does he think? Oh my God, right. I've got a choice of spending about $10,000 or $12,000 more a year in covering all these people, jettisoning 2 or 3 employees, or taking my coverage and my key employees' coverage off the table. When in reality, the answer was, will you pass discrimination testing still? And the answer was, yes, you will, okay. And therefore, you're okay. Okay. But I didn't want to end the conclusion only because nobody cared I wasn't going to talk about it. But it didn't. It's his business, and so if you don't care about the answer, you don't care. But it really turned out, if he knew somebody to call and question, he knew a good broker like Mike or anybody else here,
about the testing,
he would have had that answer.
Okay. So it's still a non-grandfathered plan, it's just that it passes testing.
Yeah,
so it doesn't have to
right. The answer ended up being, I don't care if you're grandfathered or not.
You don't have key.
You don't actually have key employees so you can pass. Now, another way we were going to solve the problem, until I actually asked that question of tell me what people make as a census, was put out a mailing to everybody saying, regardless of what Pacific Source said, this plan is still grandfathered. They're the insurer, they have the contract with the company, but not a direct contract with the individual. So I can, as a plan, the company plan, I can override what Pacific Source says. Some people did this when the domestic partner rules came out. Religiously, I'm not going to cover a domestic partner, same-sex domestic partner. So regardless of insurance contract, I'm going to send out something to you that says, not covering you.